All right, so
you answered the first 6, right?
Me?
Yeah.
I got to number 9.
You wanna kind of lead the way on those ones?
Sure. Okay, so techniques/equipment to administer oral medication to children. I sort of started going off memory, and then I tried not to do that because I want to make sure we're on the same page. So I'm sorry if this is hard to read.
do you know what chapter it was? What chapter was it?
I wrote page 106.
106. Okay. All right.
So a syringe or a med cup, remember, no spoon, but a teaspoon is 5 mLs. I had that written down. And then if it's less than 5 mLs, it's not accurate to use a cup. You should use a calibrated syringe. And there were several options, like with a needle, without a needle, all that jazz. But normally we use, the baby syringe with the little sucky thing on it. And then I found later on to make sure that the baby's head or small child, whatever, is slightly elevated, and place the dropper. So it said dropper, but it didn't really talk about using a dropper in any of our evaluations and stuff. But usually those would be the same as a syringe if they're like, the infant Tylenol. Right, the little baby Tylenols. Those are calibrated just like a syringe. But you could also switch out the dropper for the syringe. So for that wording, just so we know. And place the dropper inside the mouth beside the tongue. Make sure the head is slightly up and back, and put it right in here. And then it just listed several things about if the baby is crying. Basically, just watch for, try to avoid aspiration and watch the respirations after you give it if they're fussing while you're giving it. Does that sound okay with everyone?
Yeah. And then also you can mix it with a sweet food, but it very specifically says don't mix with an essential food item like formula or milk, because the child may reject the food later because of a bad association with taste.
Did you say putting it between the gums and cheek?
I don't think you could do it buccal.
No. That's how you. So they don't, because like babies have the reflex of like spitting things out, like pushing things back out. So one of the techniques for administering oral meds is you stick the syringe to administer it between their like gums and cheek. So then they don't have the ability to push it back out.
Oh, okay.
Right. So
it's not really buccal, it's still an oral. It's just how you administer it.
The book says to go in beside the tongue, which I'm thinking between the tongue and the teeth, but they don't have teeth. So it would be like the tongue and along the gum line, so it kind of shoots right back.
Yeah, but it's like go on the side instead of down the middle.
Don't go in the middle because they're more likely to either spit it out or choke. And then for technique to administer IM medications. So I didn't go into depth when I wrote this out. I'm sorry. I was rushing. But there's the regular 90-degree angle where you just poke and shove. But there's also the Z-track and the airlock method. So for the Z-track, you're going to identify your site and then hold the skin taut, jab, push, and then let go of the skin so it kind of goes back to being squishy, and then pull it out, because then as the needle comes out of the different layers, the medication stays down here because it can't squirt back up with the needle because it's like that.
Okay.
And the airlock method, that one is basically just like your regular poke and push, except that you don't take the air out of the syringe. So when you, like a flu shot, we'll say, that always has about 1.5 to 2 mLs of air in it at the top. You would leave that in, and then when you when you change the angle of the needle, the air will become to the top of the medicine instead of the bottom. And then once you put it in, there's an air bubble sitting on top of the pocket of medicine. So as you pull the needle out, the air bubble locks it in the muscle.
I'd also mentioned the
and then-
doses too. And the
yeah, so I was just,
contraindications.
that
Okay.
one- I didn't get to contraindications, I forgot. But for the needle gauges were 18 to 21 for thick medicines, but in general, we had said what was it, a 21 to 23 gauge, and the length is 1.5 to 3, and it's a maximum of 3 mLs given for 1 IM. So for instance, if you had a 6 ml, you would have to give that in yeah, you would have to give it in with 2 syringes and 2 injections. Sylvia just texted and said she's still in another group meeting. It's my train of thought. So no more than 3 mLs per dose, 1.5 to 3 inch needle, but I think we can all agree we've never seen a 3-inch needle used on a human. Airlock, Z-Track. Do you guys feel like that kind of, I forgot the contraindications, I'm sorry.
All right, but no, so that's just like one of those where you have to check the drug book and make sure that like if it specifies not to put it in the deltoid, because we had that one medication where it was like less than 2 ml, so you would think it would be okay to put it in the deltoid, but it specifically said large muscular region. So you had to put it in
was
the
that the Solumedrol or whatever?
I don't remember one of the drugs.
Yeah, but just for personal use, you guys remember, because I had somebody fuck me up when I got my first MA job where I gave injections. This bitch told me to put it in the arm, and I put it in the arm, and I got a fucking write-up for it. So Solumedrol goes in the ass every time.
Oh my gosh.
You're never gonna forget the name of that, man.
Never. Okay. And also Solumedrol comes in a glass ampule where there's a bubble on top of saline and a little regular medicine bottle on bottom, and it's kind of like an hourglass, and you push it down and there's a stopper in the middle and the water comes down and dissolves the medication. It's really funky looking and it can be confusing. Anyways, thank you. Side note for me for the day.
Okay, hold on.
That was so messed up for the nurse to do.
I know.
Or whoever.
And
yeah.
then and they're like, why did you do that? The provider. And I'm like, well, I couldn't remember. So I double checked with Teresa and she told me to give it in the arm. And she's like, I would never say that. I was like, oh, no, you did not just fuck me.
Wow. That bitch.
Right?
What I would have done is I would have verbally confirmed it with another nurse standing right next to me, like, just to clarify with this person present, listening in on this conversation, that I am supposed to, you are telling me to put it in the arm.
So there were 2 of them and they were ganging up on me and they're both like, oh, I didn't, the one's like, oh, I'm busy. I didn't hear that. Mm-hmm.
Wow, some people are shady.
Yeah, let me tell you. So watch out for them shady bitches.
All right, and then the ventrogluteal is the V thing. So you find the trocar thing and you make the V with your fingers and you have the as is, I see.
Follow the spine and then the finger goes and then you're right in here, right?
Yes, because you have to make a V with your fingers. That's how I remember it.
That's the one that feels like you're shooting it into their hip bone.
Yes. Yeah. Okay.
Aww. I
have
piggy.
And then you're like, okay, I'm still real quick. I'm just
so
a little confused. Where's the? I don't see the airlock in here at all.
Okay, so I don't remember where I read that. It was in, I want to say chapter 9.
Well, I'm in chapter 9. I'm looking. I see. I'm at intramuscular injections, and I see there's intramuscular injections, and there's the Z-Track method for irritating substances like iron, dextran, and hydroxyzine. But whatever. Okay.
I know I read it and they never brought it up, and I was gonna say something, but I wrote it down just in case.
Okay, well, if she
But I
didn't say
do
anything
remember
about it,
that-
I'm not worried about it.
Oh, here it is. The bottom of 113. There's a picture. It's right there.
13. Oh, okay.
Yep, right under the green box.
Okay. All right.
Okay, so
I'm not worried about it, but
so number 3, effects of medications to the fetus in relation to specific trimesters of pregnancy. So this is your increase to have the greater damage in the first trimester, which is 1 to 3 months.
Wait,
This is when
page,
most
what chapter is this? Again, is this still
Um,
9?
I didn't write it down.
All right, I'll just look in the index. All right.
I had it in my notes. I'm sorry. Oh,
Sorry, I want to know so I can write down the thing so I can go back and
I know I
read.
understand. I do that too, and I was rushing.
FETAL, not fertility drugs.
Reason my whole computer like glitched, and like the whole Zoom screen is like black, but I can see your guys' names.
Oh, damn.
Oh.
I don't know. Very weird.
Ethical
Anyways.
considerations, gene therapy, pharmacogenetics, substance abuse. Ow. Women's
I'm
health
doing club.
drugs. Sorry, I really want to.
Yeah, I'm fine.
me-
I'll find it.
All right, I'm gonna pause.